name is Madhurima Rajkhowa and I'm a consultant gynecologist in the UK. I have been trained as a gynecologist but also as a subspecialist in reproductive medicine. That means my specific area of practice is in fertility and assisted conception. And in this area, I've worked for more than 20 years as a consultant, both in the NHS in the UK, as well as in the private sector as a medical director most recently. I was just reading a report from the WHO which says that globally, 1 in 6 couples unfortunately struggle with fertility. And that's really very common. That means 17.5% of people worldwide struggle to start their family or to grow their family. And interestingly, the proportion of patients who have subfertility is the same whether you are from the wealthy high-income country or a low-income country. So it's worldwide, it's a big global problem and it has to be addressed. As you've said, it has a huge emotional, mental toll on couples, and of course the physical health. It may be because that may be the reason for the subfertility, but it may be an outcome or as a consequence of having difficulty in getting pregnant. You know, almost every couple thinks automatically that they'll have a family when they're ready to start, and it's a big blow when it doesn't happen naturally. So yes, it is a big problem both to the physical and mental well-being. People, when they have difficulty in getting pregnant, think, oh, I will do the least invasive thing and I will do simple things and that will all solve the problem. But that's not how it works. It has to be personalized. It has to address the reason for the delay in getting pregnant, and just having a tablet will not take it away. It'll just delay in having the most effective treatment. So the range of treatments is huge, but the important message, I guess, for couples is that you have to make it personalized to meet your needs and to reduce the time to pregnancy. Because what happens is that you have repeated failures with non-invasive, less effective treatment. And when you come to the treatment that may be the most effective, it becomes less successful because you're older. Because the most important predictor for pregnancy in couples is the age of the female partner. Today, perhaps IVF with or without ICSI is the most effective form of treatment for IVF. And people feel frightened about going ahead with IVF because they think, oh, it's invasive, I don't really need it, and they are overwhelmed with the cost, the technical, sophisticated information that's given to them. But in reality, IVF is pretty straightforward. And it can be done very quickly in just a couple of weeks. And in a woman who's less than 35 years, the pregnancy rates can be in the UK about 40–45%. Whereas if you are 40 when you're having treatment, the chance of treatment is 20%. And when you're 43, that is only 5%. So age is very important. So let us talk about when should we have treatment. But before that, let's come to a diagnosis. Why do you need treatment? Then we decide what is the most effective form of treatment, and then where do you have this treatment? And when you think, where do you have this treatment, you have to have global standards. And today, I think there are many countries worldwide who will meet the standards. And India is one of the upcoming markets where there is all the equipment, all the expertise, all the trained doctors, embryologists, laboratory facilities, where it can be competitively priced. So patients should look globally, worldwide, to see where they can have their baby and the family. One of the issues highlighted everywhere, like the WHO or in global health reports, is the cost of treatment. So most couples are more comfortable where they are. But data shows that a lot of people find it hard to access treatment because of lack of, say, government funding or NHS funding, and the price can become insurmountable. So we have to look globally now. We have to look where can we get treatment which is of the same standards, but perhaps a little bit more cost effective, so that couples have a better chance of actually accessing the treatment and going home with the baby. So the main concern for people as to why they were worried about traveling overseas was A, the lack of regulation, lack of transparency, the concern about maybe clinical practices not meeting international standards, and also perhaps concern about how they're going to proceed. They don't know how to select the best clinic, etc. But the main driver, perhaps, for change now is going to be, say, in India, for example, where we are hoping to be able to offer successful treatment, is that there is now regulation. There is an ART Act which makes it essential for clinics to be licensed, to have transparency, to be absolutely clear as to how they provide treatment, who they provide treatment to, the success rate, and most importantly, the cost. So once we have overcome those barriers, I think that patients perhaps can be more confident about where they access treatment, knowing fully well that they will be supported in making sure that treatment is successful, it is safe, there's less risk, and it is cost effective. And more important, they have the additional value of having good support all the way through, empathy, personalized treatment. We want to say that at TMTC, we are committed to providing treatment of the same standards that they would expect globally. Not just in the treatment itself, but the experience as well. We will be able to provide treatment when they want treatment. There is no waiting time, and this is perhaps one of the important drivers to consider treatment here, perhaps supported by us in India, because there will be treatment when they're ready for it. The concern expressed by patients and some colleagues is that, you go there alone, there's no support. All of these have been addressed. So there is a UK highly experienced clinician who is experienced in reproductive medicine, who collaborates with a highly experienced, skilled professional clinician in India. And the patient is seen in partnership with the patient and both the doctors. A personalized treatment plan is made to meet their requirements, and the treatment is explained in detail as you would expect, with full explanation, full information, full transparency about the treatment, about the pathway, and very importantly, the cost. Once they have decided they wish to have treatment, then there is a concierge service which will support them, and very experienced patient support team who will talk them through every step of the journey. Once they arrive in India, they will already have a clinic which has been assessed and selected to be able to provide them the experience and the treatment that they expect, with the kind of success rate that they would hope to achieve anywhere based on their age and their requirements. In addition, the important thing is that there is aftercare after the clinic, after the procedure in India itself, and extremely importantly, there's follow-up care when they go back to India, because they will still have the consultant in India who will be able to support them and look after them till they're ready to go back to the NHS, hopefully with a pregnancy that will be supervised there.